home. I am a friend of the Community Issues Forums. The last time I was here, I was with Dr. Marilyn Bates Mims, who is a mentor, and she's also a member of the Christ Church Cathedral. Just to tell you my background, when I was here with Dr. Mims, I was discussing the 13th Amendment. I ran for the U.S. Senate in 2016, and I was appointed to the Democratic National Convention's Platform Committee. And the piece that I focused on is the 13th Amendment, removing the exception clause from the 13th Amendment, which is the clause that says neither slavery nor involuntary servitude shall be allowed except if you're duly convicted of a crime. And so Dr. Marilyn Bates Mims and federal retired Judge Arthur Burnett out of DC helped me to form that piece. And so again, other than that, Bill mentioned the Homeless Coalition, the Housing Clearinghouse, and I am a part of the Housing Clearinghouse. Like Bill said, in 2017, Cincinnati had a 40,000 unit affordable housing shortage, and now I would say that it's closer to 50 to 55,000. And so considering nationwide, there was an ABC report that said that we had 550,000 homeless citizens in the country. To think that 10% of the nation's population of homeless live right here in greater Cincinnati or Hamilton County is disheartening to me. So I kind of went into my spiel, but let me tell you who I am. I am Kelli Prather. I'm a local social justice and civil rights activist, extremely passionate about quality of life issues. I need to share a praise report. I am also a cancer patient like Commissioner Todd Portun was, and I had my last radiation treatment today. So excited to be here to be able to share that with you and to also get recommended. But right after my radiation treatment, my first thought is go and celebrate. But no, because I'm an occupational therapist and I'm passionate about addressing the health disparities, I went to work. So I'm literally here on my lunch break, which is a good thing, but proud product of the Cincinnati public school system, born and raised in Cincinnati, a trailblazer, first generation college graduate. I have a master's in occupational therapy, and I'm also working at the Union Institute on a PhD in public policy. And what I want to do is I want to take those policies and implement the changes that we need to see for the most vulnerable populations. So I know Connie mentioned she did her homework. I have 6 college degrees, so I've done a lot of homework. And I think I'm the best candidate. I know Connie also said that. But I'm just really excited to address the housing crisis in the city, the health disparities in the city, the economic, the wealth gaps, and kind of bridge the divides. Because, like I said, I have real life experience. I was a caregiver for my mom who had Alzheimer's. So being that I'm a clinician, I've been a consumer and a patient, I understand what it takes to create policies that's going to resonate from the hospital to households and help people to be healthy and whole. I'm also really passionate about animals. I have a puppy. A lot of people don't have animals. A lot of people have children and some people don't have animals, but I love animals. And I'm really passionate about making sure that I work with citizens on protecting the warden, the pet warden, making sure that we don't continue to give a lot of money to the SPCA, but we fund programs that are going to keep pets alive, because the SPA, if God forbid you have a terminal illness and you have to put your pet there in respite services, they'll kill them. And so we need to get services in place where our pets are protected, because the emotional support animals are real. A lot of people need those to survive. In terms of development, sadly with a lot of the development, and I am a huge fan of development, everyone wants a city that's well developed, but what's a well-developed city without underdeveloped people? And so I want to get those resources to Jobs and Family Services to help people to make sure that they get programs for parenting to keep their children safe. They get programs to help with taking care of their parents. Like I said, I was a caregiver for my mom who had Alzheimer's, and so I know that a lot of resources are needed there. I also want to work with programs like the Urban League and make sure that we have job training programs, and then also the African American Chamber and the Regional Chamber to ensure that we have the resources to build entrepreneurs. Like I said, I'm a first generation college graduate and a first generation entrepreneur. Aside from working for different contract agencies, I also have a small business, and to be honest, it's been very difficult for people who look like me, brown and black people, to get contracts in the county. And because the county has not served poor whites, black, and especially brown people, I want to make sure that we change that dynamic. So just really excited to be in this space. Like I said, I ran for the U.S. Senate in 2016, was appointed to the Democratic National Convention, ran for 3 months, spent less than $5,000, and got 139,000 votes statewide. And so my message resonated, and they wanted me to be a part of the change that we need to see here, not only here in Hamilton County, but nationwide. So really excited about working to improve the quality of life. My campaign is really centered around quality of life issues. So I know a lot of times you hear families talking about the money. Yes, the money is the root cause, the money is there, but we need someone who has had real life experiences and know where the money should go, and just be able to implement policies with clear outcome measures. And here I am, Kelli Prather. Hopefully I can get your support. I do have cards. I have a website. It's kelliprather.org. So if everyone could take a look at that, I would greatly appreciate it. Okay, all right, if everyone could take a look at that, I would really appreciate it. But again, I'm a friend of Christ Cathedral, and this will not be the last time you see me. So hopefully.